There is no human being having not experienced back pain during one's lifetime. Everybody gets one. They may last for a few weeks and then subside and forget till you get the next bout. So, some back problems get better by doing nothing or temporizing measures like heat therapy, application of anti-inflammatory gels, physiotherapy, chiropractic, herbal therapy, yoga, and so on. Some get better with such temporizing measures, but others unfortunately need surgical intervention for relief. Most backaches are due to strains of the soft tissues in your back, caused by straining your ligaments or the muscle columns called erectospinae muscles that supports and gives stability to your back. Doctors label this condition as lumbosacral strains in the lower back. Temporizing measures mentioned are sufficient in such soft tissue strains. With age, some people get chronic backaches due to degeneration of the intervertebral discs that cushion the bones, or the bones themselves undergoing softening referred to as osteoporosis. The spine or the vertebral column usually consists of 33 vertebrae placed in series and connected by ligaments and intervertebral discs. There are 7 neck or cervical bones that can be moved in all directions on top of the chest thoracic bones that form a fixed cage with ribs and the sternum in front, which protects your internal organs such as the heart, lungs, windpipes, gullets, and so on. Then in your lower spine, the lumbar region, there are 5 bones, quite strong, solid, and mobile to move your torso in all directions. Good golfers seem to have a very mobile lower back. These lumbar vertebrae are supported on 5 sacral bones that are not mobile. So the mobility for everyday functions are limited to the neck bones and lower back lumbar vertebral bones. As one ages, you may get severe backache due to softening or demineralization of the vertebrae. This condition is referred to as osteoporosis. This is more common among females due to hormone deficiencies or imbalances. In the United States, 10 million people have osteoporosis. 80% of those are women, and 34 million are at risk for developing the disease due to low bone density. Osteoporosis is a public health issue because the disease contributes to 1.5 million fractures or broken bones, including 350,000 hip fractures annually. It is known that if you were athletic during your school days, that favors to have strong bones right through your life. In most cases, they may not know that they have osteoporosis until a complication when the bones collapse with minor injuries related to a fall, bending or twisting, or even after a sneeze. As the bones of the spine lose mineralization and strength, they can collapse, causing a hunch over appearance often referred to as a Dowager hump. All women over the age of 65 who have risk factors must have bone density testing. Now let's talk about spinal stenosis, the commonest chronic back problem men and women get. This is a condition due to degenerative changes in the spine as one ages. The spinal canal is about 14 millimeters in diameter. When it constricts to 12 millimeters due to bone growth resulting from degeneration of the vertebra, will result in early spinal stenosis. As I said, it is a natural process of aging, and some may not get any symptoms at all. As you get older, as mentioned, the vertebral bones undergo a process of degeneration. This is called spondylosis. In addition to narrowing of the spinal canal, the opening in front of the vertebral joints called intervertebral foramen also can get narrowed due to spurs projecting into the openings, causing pressure on nerves rising from the spinal cord. Such constrictions of the nerves give rise to pins and needles or numbness in the periphery, such as the lower limbs. Sometimes the shooting pain down the back of your lower limb is referred to as sciatica. If the condition is progressive, meaning that your symptoms get worse, you need to see a spinal specialist with much experience in these surgical procedures. You need to have a CT scan of the spine to reveal degree of damage due to the degenerative changes. Your specialist will decide whether you need minimal surgery or more involved surgery. He will also try cortisone injections into the areas of inflammation, and that may give temporary relief. The operation is a decompression procedure of the stenosed area of the spine by carefully removing the degenerated bone growths that are causing the pressure on the spine. Also, you may need fusion of the spine with plates and screws. If your back problem does not get better by palliative methods, you need to see a specialist early without delaying for years. Delays can cause damage to the nerve blood supply, and the operative procedure may not be successful. Maintaining your body weight is very important to prevent spinal stenosis. Good posture in standing, walking, and sitting are very important. If the spinal cord is involved due to stenosis of the canal, this is referred to as a myelopathy. Spine surgery is all about anatomy. Understanding of spine problems is all about understanding anatomy. 5% of people are born with narrow spinal canals. Diameter of the spinal canal from front to back is 14 millimeters. 12 millimeters or less is relative spinal stenosis. When it's 10 millimeters, it is absolute spinal stenosis. In the cervical spine stenosis, it can occur in the canal or where the nerves come out of the foramina. Initially, the hands may not work properly and may have trouble buttoning your shirt, trouble in handwriting, and all that in spinal stenosis of the neck region. When the spinal cord is compressed in the cervical spine, due to cervical spondylosis and disc degeneration, gives a different set of symptoms. You get numbness and tingling in the distribution of the nerve in the upper extremities. In the lumbar region, you can have weakness and numbness in your legs in spinal stenosis. Indications for surgery are: weakness is progressive and severe, pain is significant and disabling, loss of power of the bladder control. Operation approaches could be through the front of the spine or the back of the spine or from the side of the spine. Spondylolisthesis. This is a situation where the fourth lumbar vertebra slips over the fifth lumbar vertebra. This can cause pressure on the spinal cord and cause stenosis. In such a situation, the surgeons fuse the two bones together to prevent further slipping. Decompression takes pressure off the spine and may have a fusion if the spine is unstable before or after operation. In conclusion, if your symptoms are progressing with no relief from palliative methods described earlier, you need to see an orthopedic surgeon specialized in spine surgery. Hope this was useful. Thank you and stay safe.